Welcome to Cadence Chiropractic. I'm Dr. Nelson.
And I'm Dr. Todd.
You know, one of the most common sayings that we've heard is that if something has gone wrong, then at least you got your health, right? But what if you don't have your health? What if you're suffering from symptoms right now? Things like low back pain, neck pain, headaches, migraines, or maybe you have something like stomach issues, high blood pressure, a variety of things that affect our health. You understand that it can affect everything and it can have this compounding effect in your life. Whether or not it's like your ability to just go to work or to just simply put your kids to bed. And ultimately, here at Cadence Chiropractic, the whole purpose, or what people would say is our why, is we want to remove stress so that you can enjoy life. Right? Now that stress may be something like low back pain, it may be neck pain, it may be headaches, it may be a variety of those issues. But ultimately, we want to give you an opportunity to enjoy life and do whatever brings you joy. That's spending time with your family, going to do whatever activities you like to do.
So when we look at an example of something that might get in the way of you being able to do those things, low back pain is really common. And one of the things that we're good at is taking away that low back pain. But unfortunately, what other options do you have to help yourself function properly and get your body working the way it's supposed to? In the medical model, the options are taking some medications or drugs or surgery. And that's not always a full fix because we're just covering up symptoms at that point. In fact, we know that the majority of back surgeries actually fail. And what that means is that after the surgery is done, the pain that people are dealing with that affects their life is still there. We had a patient that came into our office with terrible sciatic pain and low back pain that was affecting everyday activities. Couldn't do stuff with his wife, go out and do activities. It was affecting work, and he was just in a bad place. Now, what options does he have on that? Medically, there's medications that cover symptoms and maybe dulls the pain, but doesn't last long. Or surgery. And being a young person, surgery is just not an option for him at this point. So after doing a few months of chiropractic care, his low back pain and sciatica is completely gone. His wife was just telling us the other day that they're doing activities that they couldn't do a while back, and it's just changed so much about their day-to-day activities.
What it really comes down to in this office is we really want to know what the cause of your concern is. Now, that's one of the reasons that we did such a thorough evaluation at the beginning, because when it comes down to it, we're going to do things differently than what a doctor or even other chiropractors would do. We want to know what the cause is and correct that at the source.
That's right. We're a neurologically based chiropractic office. And what that means is we're really concerned with what the functioning of the nervous system is. Your nervous system is housed within your spine. So ultimately, as we correct the positioning of the bones in your spine, we're looking at helping to improve the function of that nervous system so that your body can do its job in healing itself and operating properly.
Yeah, exactly. So like a great example of this is a recent research study that was looking at patients with MS. What they were trying to discover was what had led to that problem. In the study, they actually discovered that about 5 to 10 years previous to the diagnosis of MS, that the patient had suffered some kind of cervical injury, like from a car accident or something. And when they took the MRIs, what they found is that there is a fluid that surrounds your brain and goes down into your spinal cord. It's called cerebral spinal fluid, and it's extremely important because it puts nutrients into your brain and it pulls trash out. Well, what they found is that C1, or the atlas right at the top of the neck, had gone out of position and was actually blocking this flow from occurring. So there's nothing there to clean out trash and put nutrients in. And these patients eventually developed MS. Now, what that doesn't mean is it doesn't mean that anybody that has neck problems is going to eventually develop MS, but it does give you an idea of how much of an impact this has. You know, something simple like headaches, as an example, or migraines can be caused by this lack of flow. One of our recent patients, Brittany, she was coming in because she was getting migraines every single night at 6 o'clock and she couldn't put her kids to bed. Again, that's the stress of life, right? A couple of months under care, we got her to the point that she was only having a couple migraines a year, 2-3 migraines a year. And that's really, again, kind of what we're shooting for.
That's right. And so the way that we assess your body, we did the scan with you last time. What we're doing is we're looking for evidence of that nerve interference. Now, as we go through care, we're going to anticipate improvements on those scans. So we're going to want to see the colored bars that are on there, the reds, the blues, and the greens, to move towards the white. That's an indication to us that your body is responding. We're taking stress and pressure off of your nervous system as we go through care.
Yeah. And also, if we took x-rays last time, we're taking x-rays primarily for two reasons. Number one would be pathology. That would be things that are physically wrong. So fractures, disc herniations, arthritis. We're also taking it for structure because ultimately structure can lead to pathology. So if we take, for example, the spine, what we should see is we should see the spine straight up and down from front to back. If there's any curvatures, scoliosis, anything like that, we'll be looking at that. But also, just as importantly, is the curves from the side view. We should see three curves in the neck, mid-back, and low back. These curves actually act as shock absorbers for your spine. The force should be carried in the joints at the back, and if you lose that curve, all of that force will go directly into the discs on the side. And that can lead to a host of problems, not to mention the fact that as this straightens out, it is also going to be putting a significant amount of stress on your nervous system because it will be pulling on that spinal cord, and that can cause a host of other issues, right? Like we still even see people who come in that have had, infertility, where they've been trying for 2 years and they come in and we start care, and within the first 4 months, they're able to actually get pregnant again. Right? Or they've had stomach issues for their entire life that we're able to actually start to see improvement in because we're able to take all of that stress off of the base of the skull and that spinal cord.
That's right. In order to make these changes for you, what we do is we take all the assessments that we've done and we're going to come up with an individualized plan for you. So we're adjusting your spine to get corrections in the structure that allows your nervous system to function properly. Now, because it's a manual therapy, it's important for us to have time and repetition for your body to respond the way that we need it to. One of the ways that we do that is with our chiropractic adjustment. What's unique about us in our office is we use a special adjusting tool called an activator. What this activator does is it allows a very precise force to go very quickly into the spot that we want to adjust. It's a lot faster than my hands can be. It fires at 1/1000th of a second. So that allows us to do the adjustment without having to put all of our mass and weight into the adjustment, which makes it very gentle, very safe, and very specific to correct those specific areas that we need and not to move the whole spine.
Yeah, and we're really shooting for long-term change. So what we say is we have 3 phases of care. The first phase is what we call the halt phase. This is where we want to get on top of symptoms quickly and as quickly as possible. So you will typically have a higher frequency at that beginning, and it can take for most people anywhere between 3 to 5 weeks. That higher frequency allows us to make change really quickly. Then you'll move into the second phase that we call the stabilization phase. And this is where, again, we want to make changes more permanent. We want to not only help you get out of symptoms, but make this a lasting change where you're better and functioning better, able to do things easier, right? Enjoy life more. So this phase is where ligaments tighten, muscles strengthen, and we make some big impact. The last phase is where things are actually in a good position, and your body is going to be going through what we call restoration, which is now everything's communicating properly, the nervous system, brain is sending signals the way that it's supposed to, and your body heals itself. Ultimately, like I said, we want to make long-term change, and so when we talk about those x-rays, we're looking for some changes long-term. One of our patients, Megan, she came in and she had a really straight neck, and over that course of the stabilization and restoration phase, we were able to see a significant improvement in the curve, and that's also kind of what we're shooting for.
That's right. We're going to be in just a few minutes, and we're going to go over specifics to your case, whether that's the x-rays that we took on you and what we're seeing that needs to be corrected. We're going to go over the specific adjustment schedule and what needs to be done there for you. We're going to talk about exercises that might be helpful as well. Now, we understand that this is a big commitment and investment of your time and your resources. And we take that opportunity to help you on this journey and help your body do the healing that it naturally can do very seriously. We hold this responsibility sacred. All of our doctors and our staff are invested in your care and in your improvement to get back to those things in your life that bring you joy, that are important to you. So we'll be in just a few minutes to talk about those specifics, and we're excited to see you.
Thank you.